Running kids around is a hectic reality for many parents, but for Marina Simcox, it is a true blessing. Just 8 years ago, Marina was entering her late 30s and concentrating on raising her children, but nagging stomach trouble brought her to the doctor. She was eventually diagnosed with late-stage intestinal cancer. The diagnosis came as a complete surprise.
You assume you're going to live to old age and see grandchildren. So the shock was, I have these young children and I won't live long enough to see them grow up. I mean, that's a tremendous shock.
Marina was told she had a watermelon-sized tumor in her abdomen. A surgeon operated immediately, but he wasn't very optimistic about Marina's future. Keith Simcox is Marina's husband.
He said, well, here's the deal. I removed the primary tumor, but she's got tumors all through her liver. It looks like it's speckled all over, and there's no hope.
These CT scans show the grave reality the Simcox family was facing. Marina had what's called GIST, or GIST, which stands for gastrointestinal stromal tumor. Her liver was overrun with tumors that had spread from their original site. Doctors tried traditional chemotherapy, which did nothing to slow the violent invasion of the cancer. And as it spread, Marina's health deteriorated.
I was skeleton skin that had turned gold from poor liver function and a huge tumor load, a huge belly. And I was so weak, I really couldn't walk well, and I was on oxygen most of the time.
Marina was upstairs dying, and, had to do something to kind of feel like you were doing something, because there was nothing I could do for Marina.
I literally thought she was days or maybe a week or two from dying. She had lost a huge percentage of her body weight. She was essentially bedridden. She was white as a sheet. And she had this incredibly bulky, widespread cyst that was killing her. And there was no regular therapy that had done anything whatsoever to stunt its growth.
Marina's situation was dire, but doctors decided to put her on an experimental medication that had targeted the tumors well in previous studies. Targeted cancer therapies do just as the name implies. They zero in on cancer cells and prevent them from growing and spreading. When they work for patients, the results can be nothing short of amazing.
Once I did get that drug, my cancer cells really within 2 days were dying, and my large tumor load was shrinking very noticeably. In less than a month, an enormous tumor load shrank by about 50%. And this was a cancer that had been heavily pre-treated and nothing else had worked.
Though Marina's results were dramatic, doctors want to make sure people know that targeted cancer therapies are not the magic bullet. They're only available for a few cancers, but they're certainly a step in the right direction.
What we are doing is moving along a path that gets us to more and more specific treatments that affect the growth of abnormal cells and to a much lesser degree affect the growth of normal cells, so that the ratio of advantageous effects to side effects is enhanced. And I think we will move only further in that direction as we go forward into the next decade.
Marina Simcox says she spends a lot of time each day on her computer, conversing with other cancer patients and helping people navigate the sea of available information. She's been doing well for 5 years and is looking forward to many more.